If I was your doctor, then I would include these 4 tests to know whether you're healthy or not. The first one is LP small a, lipoprotein A. Now, this is raised in 1 in 5 individuals in the world. It is a genetic mutation test, so you need to do it only once in your life. Are there any drug therapies to treat this condition? Not right now. If you have a raised LPA more than 30, then you are predisposed to risk of heart disease, especially if you have a pre-existing cardiac history in your family. If your first generation, second generation have had the unfortunate incidents of heart attacks or any cardiac arrest, then you must get this test done immediately to know what your levels are. Obviously, there is no drug therapy, so you can't take any medication, but the same algorithm that we doctors follow for reducing the risk of heart disease in any population is applicable here. The first step is reducing your serum cholesterol levels by reducing the saturated fat content of your diet. The second is the lifestyle changes, that is including strength training, 10,000 steps, increasing the quality and the quantity of sleep, and reducing stress. So go out there, get your LPA checked. Maybe 5 years from now, when we are having this discussion, we'll actually have a drug therapy in place, and that can help us reduce our LPA level. The second is ApoB. So always give this analogy when it comes to ApoB. Imagine a highway and there are many cars going in that highway. Now the cars in the highway are these ApoB particles, and the people who are sitting inside these cars are the cholesterol particles, that is your LDL cholesterol. So people always differentiate between ApoB and LDL cholesterol. Think of this analogy: the cars are the ApoB particles, the cholesterol inside are the passengers, and who's going to cause traffic on this road? Is it going to be the passengers inside the car, or is it going to be the cars? The cars, right? So that is the problem. If you measure your ApoB particles, you will know what is your absolute level of risk when it comes to heart disease. Cholesterol knowing, or even LDL cholesterol, will only give you maybe a parameter where you need to confirm it with ApoB. So sometimes people have a lower LDL cholesterol and a high ApoB particles, which means they actually have a high risk of heart disease. But there are conditions where you have high LDL cholesterol and another higher ApoB, which means you are at the double risk of heart disease. So the gold standard for knowing the risk of having heart disease today is ApoB. So get your ApoB tested, and once you know that, you will actually have a drug therapy for that, which is your statins, which is your other medications which lower cholesterol. And always we have the dietary modifications of saturated fat lowering, high strength training, high amount of steps count on a daily basis. So these are the modalities that come for us when we are trying to reduce our ApoB levels. But test them out. Today I've seen most labs are not going for these ApoB particles. Maybe it's a 700 rupees additional test on that blood panel, but it is worth your investment, and at least you'll know what your current levels are. The third is vitamin D, and this is something I've changed my mind on because of the latest June 2024 guidelines said that there are only 4 groups which require this supplementation: adults above the age of 75 years, children between 1 to 18, people with pre-diabetes having HbA1c more than 6.4, and fourth is pregnant or lactating women. But when I work with my clients who are pushing the limits, going for marathons, high roxes, extensive training in the gym, they require vitamin D for their immunity, recovery, and sleep. So that's when I realized that these guys need their vitamin D levels above 50. And for that, they need to start with a 60,000 international units per week dose of oral, followed by, once you retest, you go back to the oral dose of 2,000 international units per day. But again, this is a little bit complicated, and I don't want to give any kind of recommendation to you unless advised by your doctor. But if your vitamin D levels are low and you're facing symptoms of poor sleep, fatigue, hair loss, you must go to your doctor, and under that consultation, ask for supplementation of vitamin D. Most people make this mistake that they go under the sun in the morning, 7 to 8, without any clothes on, trying to get vitamin D from the sun. Unfortunately, vitamin D is only got from UVB rays, and that is at the time of 10 to 12 p.m. Right? So do not go in the morning and think that you're getting your vitamin D levels. UVB rays is the one you should be targeting. Secondly, in dark skinned individuals, they require more than 30 minutes of sun exposure to get those adequate amount of vitamin D. Diet is not the way to go for vitamin D supplementation, because you need at least 20 cups of yogurts, 50 egg yolks to get that 2000 international units daily. So either go for supplementation under the consultation of your doctor, or try to get yourself in the sun between 10 to 12 pm. Second problem with getting yourself under sun exposure is the risk of skin cancer, and which is why we do not suggest any of our clients to use that 10 to 12 pm window to get their vitamin D. The last and the most important is vitamin B12, especially for vegetarians and those who are on vegan diet. If your levels are less than 200, then it is a huge red flag. I had this client who was consistently getting this aphthous ulcer, so here is getting ulcers. I did a serum B12 levels of his, and I understood his levels are 150. And that is one of the symptoms of vitamin B12, other than the brain deficits, poor fatigue, less sleep, poor recovery, and generalized weakness throughout the body. So get your levels tested for vitamin B12. There are nuances to this. If you have high vitamin B12 levels in the serum, it could be that the active form of B12 will be less. And I'll create a complete video on this topic. But right now, I just want you to understand that there are 4 tests which you should do and consult with your doctor for supplementation. B12 luckily can be consumed via animal-rich diet plan. But for vegetarians, it would be wise to go for supplementation via the IM route or via the oral route. But remember, there are things like pernicious anemia. So this is because you have the lack of an intrinsic factor in your stomach. So if you don't have this factor, even though you take vitamin B12 orally, it's not going to change your levels. So my suggestion here is, again, consult with your doctor. If your B12 levels are unreasonably high and you still feel symptoms throughout your body, then you need to do the active form of vitamin B12 test. And again, that is up for a second video. But hope you understood what I'm trying to tell you here with respect to your health. Just because you might not feel any of these symptoms, the moment you get a blood test done, you'll realize that, oh, I'm deficient in these kind of tests and I need supplementation, I need to consult my doctor. Today in India, the first 2 tests are not being talked about. Only we talk about D and B12 because everybody else who is not affiliated with the medical field and who is a performance athlete has been talking about these 2 topics. But with heart health, and in India, the cases are extremely high. So get your LPA levels done, get your ApoB levels done, switch to a low saturated fat diet plan, exercise regularly, get your 10,000 steps on a daily basis, sleep and reduce your stress. Trust me, even if you are having all these levels adequate but your stress levels are high, then obviously you're going to have that metabolic syndrome phenotype, which is thin outside, fat inside. And when we say fat inside, we're talking about the dangerous amount of fat, that is your visceral fat, that covers your organs and releases toxic metabolites into your bloodstream, which contributes to type 2 diabetes, high blood pressure, insulin resistance. Thanks for watching this video. And if you have suggestions for other topics which we should cover in detail, please put your comments in the section down below. Thank you.